Great. Important is very good, all of you. So that's important. So here the answer is option A, that is res ipsa loquitur. What is res ipsa loquitur? Please remember, res ipsa loquitur का मतलब ये होता है fact speaks for itself. Okay, so fact speaks for itself. Okay, so fact speaks for itself. Definitely, that is what is called as res ipsa loquitur. ठीक है, जब प्रत्यक्ष को प्रमाण की जरूरत नहीं होती, दैट स्टेटमेंट जस्टिफाइज रेस इप्सा लोक्विटर. ठीक है, जो तुम्हें सामने दिख रहा है उसको प्रूव करने की कोई जरूरत है क्या? नहीं है. तो यहाँ एक्सरे पे सामने दिख रहा है कि द फोर्सेप्स वाज लेफ्ट इन द abdominal cavity. That is the reason why here the fact does not require any further evidence. It is speaking for itself, and that is what is called as res ipsa loquitur. ठीक है, so if nothing is required, no evidence is required to prove the condition, that is what is res ipsa loquitur. On the other hand, what is res judicata? So please remember, res judicata, that means the things are decided. Okay, res judicata का मतलब होता है things are decided. That means a judgment was given on a particular case. If the judgment was given and that will not be reversed now, that is what is called as res judicata. ठीक है, तो res judicata का मतलब होता है the thing or the judgment is already decided, it cannot be reversed back. That is what is res judicata. And what is novus actus intervenus? It is in the name itself. Novus का मतलब होता है new. Okay, actus का मतलब होता है act, and intervenus का मतलब होता है intervening. So if you are performing a new act, okay, so you are performing a new intervening act, definitely, and that causes some problem. That is what is called as novus actus intervenus. ठीक है, that means तुमने surgery के दौरान definitely you have performed a new act. Okay, you have ligated an artery, and due to which the patient had some gangrene वगैरह. So that is what is called as new act intervening. Okay, there was some problem during the surgery, and due to that you had to perform a new act which is not regularly done in that particular surgery, and due to which the problem has arisen. That is what is called as new act intervening. ठीक है, novus actus intervenus. यहाँ पे कोई नया एक्ट नहीं किया. फोर्सेप्स छोड़ना कोई नया एक्ट नहीं होता है, कोई जरूरत नहीं होती है. बट देन ऑल्सो द डॉक्टर हैज लेफ्ट द फोर्सेप्स, एंड दैट इज नथिंग बट ग्रॉस नेग्लिजेंस ऑफ द डॉक्टर और सर्जन. ठीक है, थेरेप्टिक मिसएडवेंचर का क्या मतलब होता है? थेरेप्टिक मिसएडवेंचर, थेरेप्टिक का मतलब होता है ट्रीटमेंट. तो ट्रीटमेंट के दौरान अगर कोई बुरी घटना हो जाती है, दैट इज व्हाट इज मिस एडवेंचर. ठीक है, सो ड्यूरिंग ट्रीटमेंट डेफिनेटली इफ एडवर्स थिंग हैपेंड, ओके, और देयर वाज अ side effect, or there was some problem which happened during the surgery, during the treatment of the patient, that is what is called as therapeutic misadventure. That is not due to gross negligence of the doctor. Important is that is not due to gross negligence of the doctor. ठीक है, तो usually for example a surgeon was performing the surgery, and due to which while handling the structures क्या हो गया, गलती से कोई ना कोई आर्टरी को इंजरी होगी, and the artery started bleeding, or there was injury to the intestine and there was a perforation, small perforation, or there was injury to the common bile duct and there was some leakage from the bile duct. Definitely these are what are called as therapeutic misadventures. ठीक है, so during the treatment or during the surgery definitely there was some problem, that is what is called as a therapeutic misadventure. But again, here it is not a therapeutic misadventure. Here this is an example of a gross negligence, and therefore the answer is straightforward, res ipsa loquitur, a sarkari question of FMT from your examination, never to be forgotten now. Okay, so that's important. Moving further, question number 2, if I talk about, here it says a dead body was recovered by the policeman from a river and sent for post-mortem examination. Okay, you suspect the patient was alive while drowning. Okay, which among the following finding will not be seen? Now, first of all, if the dead body was recovered from the river, definitely, then what are we suspecting? That the patient has died due to drowning. The patient has died due to drowning. A lot of people are not aware of drowning. Drowning मतलब कुछ नहीं, डूबना होता है. Drowning का मतलब ही डूबना होता है usually. ठीक है, that is what is drowning. So death caused by drowning in this patient, that we are sure. Okay, so definitely हमें क्या पता है कि अगर डेड बॉडी रिकवर की गई है रिवर से, डेफिनेटली वी आर सस्पेक्टिंग दैट द डेथ माइट बी कॉज्ड बाय ड्राउनिंग. बट इंपॉर्टेंट इज वेदर इट विल बी अ एंटीमॉर्टम ड्राउनिंग और अ पोस्टमॉर्टम ड्राउनिंग. व्हाट डू आई मीन बाय दिस कंडीशन? एंटीमॉर्टम, दैट मींस बिफोर डेथ. ओके, बिफोर डेथ द पेशेंट हैज ड्राउन्ड, दैट मींस मरने से पहले उसको पानी में धकेल दिया गया एंड उसकी वजह से ड्राउन होकर पेशेंट मर गया. दैट इज व्हाट इज अ एंटीमॉर्टम ड्राउनिंग. ओके, सो द पेशेंट वाज पुश्ड इनटू द रिवर before death. The patient was pushed into the river before death. ठीक है, so that is what is anti-mortem drowning. What is post-mortem drowning on the other hand? Post-mortem drowning का मतलब होता है after death the patient was pushed or the dead body was pushed into the river. ठीक है, याद रख लो, ये दिखाना था जो भी अक्यूज था, जो भी मर्डरर था, उसको क्या दिखाना था कि ये जो डेथ हुई है, it is usually due to drowning, and therefore he kills the person first. He kills the person first and then pushes the dead body into the river. Okay, that is what is the post-mortem drowning. Here the body is pushed into the river after death. Here the dead body is pushed into the river after death usually. That's the basic difference between ante-mortem and post-mortem drowning. So definitely, if you are suspecting that the patient was alive while drowning, that means we are thinking in terms of anti-mortem drowning. Okay, हमें क्या लग रहा है कि पेशेंट शायद जिंदा था जब उसको पानी में ढकेला गया. ओके, द पेशेंट वाज अलाइव while he was drowning. That is case of anti-mortem drowning. And what are all the signs of anti-mortem drowning? Definitely we need to find which of the following is not a sign. So if I talk about which are the signs of anti-mortem drowning, definitely, okay, so first one, as you can see, I will show it to you over here images ke sath. The first one that you can see over here is this one. What is this? Cadaveric spasm. So now if a alive patient or alive person was pushed into the river, वो क्या करेगा? वो अपनी जान बचाने की कोशिश करेगा, इसीलिए he will struggle. And जब वो struggle करेगा, he will try to catch anything and everything that comes in his hand. Okay, therefore he tries to catch the mud, the grass, the weed, the plants, anything. Okay, and therefore usually he has a spasm of specific group of muscles. And which are these group of muscles? Usually the hand muscles. So क्या होता है? Usually if a alive person was thrown into the river, he tries to catch something, and that leads to spasm of these group of muscles of the hand, and that is what is called as cadaveric spasm. Important is, this was an important question, that cadaveric spasm is the most specific sign. Cadaveric spasm is the most specific sign of anti-mortem drowning. That's important. Okay, so अगर कोई जिंदा इंसान धकेला गया रिवर में, उसकी सबसे ज्यादा इंपॉर्टेंट और सबसे ज्यादा स्पेसिफिक साइन कौन सी होगी? तो आंसर इज cadaveric spasm. Okay, so cadaveric spasm is the most specific sign of anti-mortem drowning. That's important to be remembered. Next important is frothing. Definitely, yes, there will be a froth coming out from the nose or the mouth of this patient. If a alive person was pushed into the river, definitely he'll try to struggle. The person will have respiratory distress. ना क्यों? क्योंकि पानी जो होगा वो पानी पूरा का पूरा कहाँ चला जाएगा? एयरवे के अंदर, और वहां से लंग्स में चला जाएगा. Okay, therefore if this water goes into this airway and into his lungs, what will happen? The mucus, the surfactant and the water, everything will mix together, and that will form a tenacious thick secretion, and that is nothing but froth. ठीक है, जब हवा, म्यूकस, सर्फैक्टेंट और पानी सब एक साथ मिल जाएगा तो क्या बनेगा? फ्रॉथ बनता है. ओके, एंड देयरफॉर इफ अ लाइव पर्सन वाज थ्रोन इनटू द लिवर, दैट इज इन केसेस ऑफ एंटी-मॉर्टम ड्राउनिंग, यू विल सी फ्रॉथिंग फ्रॉम द नोज एज वेल एज माउथ ऑफ दिस पेशेंट. ओके, सो फ्रॉथिंग इज इंपॉर्टेंट साइन अगेन फॉर एंटी-मॉर्टम ड्राउनिंग. दिस इज अगेन अ स्पेसिफिक साइन. Next is what is emphysema aqueosum. What do I mean by emphysema aqueosum? Definitely over here you can see that if a person or if a person was breathing, okay, if a person was breathing when he was drowning, that means जब तुमने जिंदा इंसान को ढकेल दिया रिवर में and वो breathe कर रहा था, definitely he try to struggle. Okay, he will have respiratory distress and therefore वो ज्यादा deep सांस लेगा. तो जब वो deep सांस लेगा तो क्या हो जाएगा? ये पानी और अंदर भरता जाएगा. Now what is happening? Air is also going into the lungs and water is also going into the lungs, and that will lead to increase in the size of lungs. Okay, that will cause increase in the size of lungs. Okay, and this condition is what is called as emphysema aqueosum. Okay, emphysema का मतलब होता है air and aqua का मतलब होता है water. So if air and water both are present, if air and water both are present in the lungs, definitely that is a sign of anti-mortem drowning. Again, that is a sign of anti-mortem drowning or drowning when a person was alive. Definitely. ठीक है, so air and water दोनों अगर है तो that is the case of emphysema aqueosum. Next is a non-specific sign. This is called non-specific by because it can be seen in anti-mortem drowning as well as post-mortem drowning. In both the condition it can be seen. That is called as a washerwoman's hand. So if a patient, or if a person was alive or if a person was dead, does not matter. If the body stays over there for a longer period of time, if the body stays in water for a longer period of time, there will be this kind of appearance. There will be wrinkling of the hand, there will be bleaching of the hand, there will be pallor in the hand. All of this together, bleaching, wrinkling, pallor, all of this together is what is called as a washerwoman's hand. ठीक है, it is what is called as a washerwoman's hand. Definitely. ठीक है, यही सेम चीज अपने को ट्रेंच हैंड या ट्रेंच फुट में भी दिखती है ना, similar kind. So that is what is seen over here. So if a dead body is immersed in water for a longer duration of time, definitely that can cause washerwoman's hand, but it is considered a non-specific sign because it can be seen in antemortem as well as post-mortem drowning. Next non-specific sign which is there, it is known as cutis anserina. What is cutis anserina? Cutis anserina is also known as goose flesh. What do I mean by this? Definitely, if the hair over the skin, okay, if the hair over the skin are erect, that means goosebumps आए हुए dead body पे. If there are goosebumps on the dead body, if the hair over the skin are erect, okay, that is what is called as cutis anserina or goose flesh. That is nothing but goosebumps on the dead body. You will say, sir, dead body पे goosebumps बस alive patient नहीं आएंगे. Not necessary, okay, not necessary. Please remember why goosebumps will happen or why cutis anserina will occur. It is due to spasm, or it is due to contraction of which muscle? It is due to spasm or contraction of the erector pili muscle. Okay, it is due to spasm or contraction of the erector pili muscle. Erector का मतलब होता है खड़ा होना, pili का मतलब होता है hair follicles. Okay, so the muscles which will cause erection of the hair, it is what is called as the erector pili muscle. And when these erector pili muscle undergo contraction or spasm, that will cause goosebumps in a person. ठीक है, तो you will say ये तो सर हमें alive patient में दिखता है ना. So definitely it can be seen in antemortem drowning when a live person was pushed into the river, but it can also be seen in a post-mortem drowning cases when a dead body was pushed into the river. Why? Because as we know, in cases of after death usually, okay, after few hours of death, there is a condition which is called as rigor mortis. There is a condition which is called as rigor mortis. And rigor mortis में क्या होता है? There is stiffening, ना? So there is stiffening of all the muscles of the body. Okay, in rigor mortis there is stiffening of all the muscles of the body. सब muscles body के कड़क हो जाते हैं, including the erector pili muscle, including the erector pili muscle. Okay, so that's the reason why a dead body can also have cutis anserina, goose flesh, or goose bumps even after death. That is due to the rigor mortis involving the erector pili muscle. ठीक है, so therefore cutis anserina is a non-specific sign of antemortem or postmortem drowning. ठीक है, coming back to our question now. Here they have asked which of the following is not seen. Now we know in a case of antemortem drowning, definitely we are discussing about antemortem drowning or when a person was alive pushed into the river. Cadaveric spasm is definitely seen. Cadaveric spasm will be definitely seen. Okay, that's the most specific sign rather. Next is Paltoff's hemorrhages. What are Paltoff's hemorrhages? These are nothing but small hemorrhages in the alveoli. These are nothing but alveolar hemorrhages. Okay, so definitely if a alive person was pushed into the liver, if a alive person was pushed into the liver, I told you he will struggle for breath. Okay, वो सांस लेने के लिए struggle कर रहा होगा because he is having respiratory distress. Therefore, he is struggling for breath. And as he is struggling for breath, the lungs have to work harder and harder. As the lungs will have to work harder, definitely what will happen to the small alveolar capillaries, जो छोटी छोटी capillaries होती है उसके alveoli में, they will rupture. And that will cause the small alveolar hemorrhages in the lungs, which is known as the Paltoff's hemorrhages. So therefore, again, important thing is Paltoff's hemorrhages are also a sign of antemortem drowning. Why? Because when a alive person will be pushed, then only he will struggle to breathe, and that will cause excess pressure in the lungs, causing rupture of the small alveoli of the alveolar capillaries of the lungs, and that leads to these small alveolar hemorrhages known as Paltoff's hemorrhages. समझ गए? So that's important. Next is emphysema aqueosum. As I've told you already, if a alive person is there, he will breathe air and water will mix together definitely, and that is what is called as emphysema aqueosum. So you will say, sir, हमें तो edema aqueosum भी लिखवाया गया है. But if I compare all of the options in the exam, if I compare all of these options which were given to you, important is edema aqueosum का मतलब क्या होता है? Edema is nothing but collection of fluid. Okay, edema is nothing but collection of fluid. Aqueosum का मतलब क्या? Which fluid? Water. Aqua का मतलब होता है water. So collection of water inside the lungs is what is called as edema aqueosum. Now please tell me that edema aqueosum can be seen in an antemortem drowning. Definitely if the patient was breathing, along with air, water will also go inside the lungs. Okay, but I've told you along with air, along with water, definitely air is also going. So more specific sign will be emphysema aqueosum, which is not only collection of air but also collection of fluid inside the lungs or water inside the lungs. That is emphysema aqueosum. So edema और emphysema में बहुत minute difference है, याद रखना. Emphysema में air plus water होता है, edema में बस water होता है lungs में. And if only water is present inside the lungs, that cannot be seen only in antemortem drowning, that can be seen even in postmortem drowning. तो मरने के बाद भी if you push the dead body also into the river, what will happen? Definitely the water will go inside the lungs of a dead body also. So edema aqueosum is again a non-specific finding. Edema aqueosum is again a non-specific sign or a non-specific finding. Therefore, it will not tell you if the patient was alive or dead while drowning. So which among the following will not be seen in a cases of antemortem drowning? और that answer is option D, that is edema aqueosum. समझ गए अभी सब लोग? If an unconscious person is drowning, even if an unconscious person is drowning, definitely there can be chances of edema aqueosum. then also unconscious person is still breathing. Unconscious person is still breathing, so air will be there. Unconscious का मतलब होता है breathe नहीं कर रहा, ऐसा नहीं है, ठीक है? तो unconscious is definitely a person who is not in his senses or not in his conscious. That is what is unconscious person. ठीक है? So that's the important thing. No issues with this, anybody? Chalo, moving further. Question number 3 now. You were performing an autopsy. Autopsy is what? Autopsy is nothing but the post-mortem examination. जो post-mortem करते हैं ना अपन, that is what is an autopsy. So you were performing an autopsy of the patient. Just a minute. You're performing autopsy of a patient who died due to firearm injury. Who died due to firearm injury. The gunshot wound which was there. The gunshot wound reveals a circular puncture wound with abrasion collar, along with burns, blackening, and tattooing around the wound. Which type of shot is it? Which type of shot is it? Now, here you are performing an autopsy of a patient who died due to a firearm injury. That means he was shot by a gun, definitely. Okay, and you see a gunshot wound. And gunshot wound में क्या दिखता है? There is a circular puncture wound. There is a circular puncture wound. It is not a wound with stellate or star-shaped margins. Okay, so that's important. So here definitely it is a circular puncture wound with an abrasion collar on the sides. There is an abrasion collar on the sides, and along with that, there is also burns on the side. There is also blackening on the side, and there is also tattooing on the side. Okay, so important is, please let me know definitely if, okay, if a person is shot with a gun, whether it is a rifle gun or it is a shotgun, does not matter. Important is definitely there will be a entry wound of the bullet, okay, or the pellet. There will be an entry wound of the bullet or the pellet, definitely. Okay, so usually apart from that, there will be a abrasion collar which is there. There will be a abrasion collar which is there, and there will be a dirt collar which is there. There will be a dirt collar as well which is there. Dirt collar is also known as grease collar. तो एक तो होती है abrasion collar and दूसरी होती है grease collar, also known as the dirt collar. Around that, around this wound, definitely there will be 3 important findings. And what are these 3 important findings? First of all, definitely the patient will have burns. First of all, around the wound, the patient will have burns. And burns are due to what? Burns are nothing due to the flame. जो आग आई है ना, आग जो हुई है उसमें से, the flames which are there, these flames will cause burns around the wound. First thing. Second thing which can be seen over here, the second thing which can be seen over here is blackening. The second thing which can be seen over here is usually blackening. And this blackening is due to what? So this blackening is nothing but due to the burnt gunpowder. Okay, the burnt gunpowder which was there, that causes blackening. The burned gunpowder jo thi na, that causes blackening around the wound. And finally, what will be seen? Around the wound you will see tattooing as well. Around the wound you will be able to see tattooing as well. And what is the reason of tattooing? Please remember, tattooing का reason होता है usually the unburned gunpowder. जो gunpowder जली नहीं है, very good. The unburned gunpowder, it leads to tattooing around the wound as well. Okay, so these are the 3 important findings apart from the collars which are seen in a case of a gunshot wound. Important is, if I talk about the shot now, yes, with the help of these findings, you will be able to identify which type of shot it was, definitely, whether it was a close shot, contact shot, near shot, or a distant shot. Important is, if it was a contact shot, definitely, as you can see in this image. Okay, the entry wound of a contact shot over here, the entry wound of a contact shot. Contact matlab, the gun was directly placed, the muzzle was directly placed in contact with the skin. Okay, and then the person was shot. So if it was a contact shot, definitely you can see which kind of margins are seen. You will be able to see here, you will be able to see a stellate margin or star-shaped margins. So if stellate, cruciate, okay, इनको stellate margins बोला जाएगा या cruciate margins बोला जाएगा. So if you are able to see star-shaped, cruciate, or stellate margins, that is more likely suggestive of a contact shot. That is more likely suggestive of a contact shot. And where will all the features be present? All the features, whether it is your abrasion collar, grease collar, blackening, tattooing, okay, burns, everything will be seen inside the wound. Okay, all the features are seen inside the wound. Okay, all the features are seen inside the wound. If I come back to our question, what does it say? Here they are having a circular puncture wound. So जैसे ही circular puncture wound अगर बोलते हैं, तो definitely we know it is not a contact shot. Further, they confirm our diagnosis how? Usually see, they are mentioning that the burns, the blackening, and the tattooing all are seen around the wound. They are not seen inside the wound. They are seen around the wound. Definitely, so contact shot is not our answer. It has to be ruled out definitely. Next, if I talk about distance shot, these are easy ones to rule out first. So please try to rule them out. If I talk about a distance shot, usually, the distance shot mein kya hota hai? If you have shot the person, if you shot the person with a shotgun usually, okay, so shotgun contains what? Shotgun, we know it usually contains pellets, lead pellets hote hain usme, theek hai. So therefore what will happen, as the distance will increase, the dispersion of the lead pellets will increase, theek hai. Jaisa jaisa distance badhta jayega between the shotgun and between the person who was shot, जैसे जैसे डिस्टेंस बढ़ेगा ये लेड पैलेट्स बिखरना शुरू हो जाते हैं, दैट इज व्हाट इज कॉल्ड एज डिस्पर्शन, ओके, दैट इज व्हाट इज नोन एज डिस्पर्शन. सो इफ इट वाज अ डिस्टेंट शॉट ना, you will see usually if it was behind 2 meters, okay, usually behind 2 meters, or some books say behind 4 meters, okay. If the shot was beyond 4 meters, definitely you will not be able to see a single wound. Usme kya dikhega? Small puncture wounds dikhenge, okay. You will be able to see small puncture wounds. You cannot see a small large, you cannot see a large single wound, okay. एक large single wound नहीं दिखेगा. You can see there will be multiple small puncture wounds usually in a case of distant shot, okay. And here nothing will be present. Here there will be no burning, here there will be no tattooing, here there will be no blackening as well, okay. Everything will be absent. Why? Because the person is beyond 4 meters from the gun. Definitely all the effects will be absent. Burning, tattooing, blackening, everything will be absent in a case of distant shot. As they have mentioned that burning, tattooing are present and it is a circular puncture wound, single wound is there, definitely distant shot has to be ruled out from the option as well. Now we are left with either a close shot or a near shot. If I talk about close shot and near shot, now important is, if it was a close shot, usually if it was close shot, that means the person was shot within 1 meters, okay. The person was shot within 1 meters. Distance between the gun and the person was 1 meters usually, okay, less than 1 meters. So definitely if the distance was less than 1 meter, here the bullet or the pellets, whatever was there, it will cause a circular wound. First thing, it will lead to a circular wound. Along with that, you will be able to see burning, you will be able to see tattooing, and you will be able to see blackening as well. So burning, tattooing, and blackening, all of these features will be present, and that too around the wound. Burning, tattooing, and blackening will all be present around the wound because the patient is still in the okay, still in a distance where the burning can reach, the tattooing can reach, and the blackening can reach the person, okay. So all of these features, if they are present, definitely it is a case of close shot, and that was your answer, okay. So close shot mein sab cheeze dikhti hai and a single puncture circular wound will be seen. Why I have ruled out near shot? Near shot is usually between 1 to 4 meters usually, usko near shot bolenge hum. 1 to 2 meters some books hai and 2 to 4 meters ko intermediate shot bola jata hai, okay. So near shot की अगर मैं बात करूं, definitely in a case of near shot, please remember it will be a circular one. यहाँ भी it will be a circular one. No issues with that. But the important thing is here burning will not be present. Here burning is definitely not present because the patient is out of the range of flame. The patient is out of the range of flame. Flame नहीं पहुंच पा रही person तक. Okay, flame is not reaching the person. Therefore, burning will not be seen around the one. Burning is not at all seen around the one. That is a characteristic feature of a near shot. Okay, now you have understood. So that's the important thing you need to remember. Okay, very important thing of the different types of shots you need to remember. Chalo. Moving further, question number 4 now. It states what? Here we have a pregnant woman. Okay, here we have a pregnant woman who visited an obstetrician with history of absent fetal movements. Okay, the person, so the fetus was having absent fetal movements. Ultrasound reveals what? Ultrasound reveals gas shadow in the abdominal aorta. And we know if an ultrasound of the fetus or during pregnancy is revealing gas shadow in the abdominal aorta, that is one of the important signs of intrauterine death. That means the fetus is dead inside the uterus. Okay, that is an important sign of intrauterine death. Important. Okay, now what is the sign described is known as, so the sign which is described in the above question is definitely known as the Roberts sign. Okay, so gas in the abdominal aorta, please remember gas shadow in the abdominal aorta, if it is seen, okay, on ultrasound, it is definitely known as Roberts sign. It is one of the signs of intrauterine death of a fetus. It is one of the signs of IUD. Next is the Spalding sign. Yes, इसके बारे में बहुत ज़्यादा सुना होगा, and that has been commonly asked in your exam also a lot of times. So what is Spalding sign? Spalding sign is what? जब fetus मर जाता है, when the fetus dies, what will happen? There will be shrinkage of the brain. ब्रेन की साइज क्या हो जाएगी? छोटी हो जाएगी क्योंकि ब्लड सप्लाई कम हो जाएगा ना ब्रेन को. तो देयर विल बी apoptosis or there will be shrinkage of the brain. As the brain decreases in size, तो क्या हो जाएगा? The cranial bones which are there, the skull bones or the cranial bones which are there in the fetus, there will be overlapping or overriding of these cranial bones, and this overriding of cranial bones is what is called as the Spalding sign. ठीक है, तो please remember the overriding or the overlapping Okay, overriding of the skull bones or the cranial bones is what is known as the Spalding sign. Important, you need to remember that. Okay, and it is due to what? It is due to shrinkage of the brain. It is due to shrinkage of the brain, definitely. ठीक है, तो ब्रेन छोटा हो जाता है तो ओवरलैपिंग हो जाती है बाकी बोन्स के, एंड दैट इज स्पैल्डिंग साइन. यस यस, इंपॉर्टेंट है. स्पैल्डिंग साइंस आर वेरी इंपॉर्टेंट एंड स्पेसिफिक साइन ऑफ इंट्रायूट्राइन डेथ. यस, अगर मैं बाकी साइन से कंपेयर करूं तो which is the most consistent and the most specific sign, if they ask you, answer is Spalding sign, definitely. Therefore it is commonly asked as well. Next, if I talk about the dual halo sign, it is also a sign of intrauterine death. But dual halo sign में क्या होता है? तुमने भगवान देखे होंगे, भगवान की मूर्ति के पीछे क्या लगा होता है? एक सूरज दिख रहा होता है ना. Okay, so just like that, usually around the head of the fetus, after the fetus dies in the uterus, you will be able to see a halo around the head of the fetus. Okay, and if there is a halo around the head of the fetus, that is what is called as the dual halo sign. That is what is known as the dual halo sign. Okay, एक प्रकाश दिखता है तुम्हें fetus के आसपास. That is what is the dual halo sign. Next is the ball sign. Ball sign क्या हो जाता है? The fetus becomes like a ball. Why the fetus becomes like a ball? Due to hyperflexion of the spine. Okay, fetus becomes like a ball after death due to hyperflexion of spine usually. As there is hyperflexion of spine मुड़ जाती है पूरी, and therefore fetus becomes like a ball. That is what is known as the ball sign. So all of these signs are definitely signs of intrauterine death, but gas in abdominal aorta is definitely known as the Robert sign. And the most specific and the most consistent sign of IUD is definitely the Spalding sign. Okay? Chalo, moving further. So if I talk about a fetus dies in the uterus itself, okay, if a fetus dies in the womb itself, that is a case of intrauterine death. Okay, so definitely what will happen? So there will be maceration of the fetus. Okay, there will be maceration of the fetus, and maceration का earliest sign क्या होता है? So the earliest sign of maceration, that was a previous year question again. So the earliest sign of maceration is nothing but skin slippage. Skin क्या हो जाती है? छूटना शुरू हो जाती है. Okay, the skin starts peeling off, or the skin starts slipping off from the body. That is what is called as skin slippage, which is the earliest sign of maceration. तुम बोलोगे सर ये maceration क्या भला है? तो maceration is nothing but one of the types of autolysis. Maceration is nothing but one of the types of autolysis. I hope all of you are quite aware. Once a person dies, usually, whether it is a fetus or an adult person, does not matter. Okay? So once a person dies, definitely the body can undergo decomposition. Body का क्या हो सकता है? Decomposition होगा. And it can occur by two methods. One is called as putrefaction. One is called as putrefaction. Putrefaction में क्या होता है? Decomposition of body होता है, but with the help of microorganisms or the bacteria. Okay, so when the body decomposes, when body सड़ जाती है with the help of bacteria or microorganisms, that is what is called as putrefaction. That is what is known as putrefaction. But when the body usually is decomposed, when the body is decomposed with the help of enzymes वगैरह, when the body is decomposed with the help of enzymes, then it is called as autolysis. Okay, when the body is usually decomposed with the help of the lysosomal enzymes mainly. We know lysosomal enzymes are also known as suicidal enzymes ना. क्यों? क्योंकि जब लाइसोसोम्स रप्चर हो जाएंगे, दे कंटेन अ लॉट ऑफ हाइड्रोलिटिक एंजाइम्स, और ये हाइड्रोलिटिक एंजाइम्स क्या करती है? तोड़ना शुरू करती है सब कुछ. ओके, therefore when a person dies, definitely the cell will rupture, that will release a lot of lysosomal enzymes, and these lysosomal enzymes will start damaging all the cells of the body, and that leads to autolysis. Auto का मतलब होता है खुद, lysis का मतलब होता है breakdown. जब खुद की body breakdown या decompose करना start कर देती है with the help of the enzymes which are present inside the body, that is called as autolysis. ठीक है? And one of the examples of autolysis is maceration, which is usually seen in a case of intrauterine death, and the earliest sign of maceration is definitely skin slippage as well. ठीक है? So these are the important things that you need to remember over here. ठीक है? This is the Spalding sign. As you can see, definitely there is overriding of these skull bones over here. ठीक है? This is the radiological sign of intrauterine death, as I've explained you. This is a picture of battered baby syndrome. ये जितने भी screenshot देख पा रहे हो, all of them are from the first part of the FMG snaps, where you will find all the images of FMT. ठीक है? तो ये सब उसी में से snapshots दिख रहे हैं तुम्हें. ठीक है? So battered child or a battered baby syndrome is what is suggestive of a child abuse. It's what is suggestive of a child abuse. Okay? So that is important. Battered child या battered baby syndrome is also important. इतना याद रखना. Here definitely the child will have multiple injuries all over the body. The child will be brought to you with multiple injuries all over the body. And ये जो multiple injuries होगी ना, they will be present in different stages of healing. They will be present in different stages of healing. Okay, कुछ पुराने चोटें होंगे, कुछ नई चोटें होंगी. They will be present in different stages of healing. Next important, usually battered baby syndrome, which is there, battered baby syndrome or a battered child syndrome. It is usually seen in an unwanted child. That means there was a couple जिनको प्यार हो गया and गलती से बच्चा पैदा हो गया. Now definitely the boy or the girl, whoever it is, ठीक है, now both of them have the right. तो किसी ने भी शादी करने से मना कर दिया तो अब क्या हो जाएगा, definitely the unwanted child will be there, and definitely what will happen, the one person, or usually it is the girl, okay, she will give birth to the child and definitely she'll get irritated, and इसीलिए वो अपने ही बच्चे को पीटना शुरू करती है, okay, she will hold the child like this and shake the child vigorously, okay, so that can happen. Or cigarette पी रही होगी तो after that definitely she usually uses that burning cigarette bud to cause pain to the child as well, ठीक है, so cigarette marks can also be seen usually on the child, ठीक है, so multiple such things will be seen. Or there will be nail marks, there will be pinch marks, usually bruises, contusions will be seen, lacerations can be seen in the child as well. So it is usually seen in an unwanted child, okay, and it is common with a male child as well. Important is that, okay. So in a divorced in a case of divorced parent or a single parent or an unmarried parent, definitely battered baby or battered child syndrome is very common, okay. So that has to be remembered, important. Yes, as I've told you, due to vigorous shaking क्या हो सकता है, definitely the child will have a lot of चांस ऑफ सबड्यूरल हीमोरेज. क्यों? क्योंकि जब विगरस शेकिंग होगी तो सर भी हिलेगा बच्चे का, एंड ड्यू टू दैट देयर विल बी अ shearing force or a tearing force, and this will tear the emissary veins which were located in the subdural space, and that will lead to rupture of these or tear of these emissary veins will cause subdural hemorrhage in the patient, okay. So all of these features are usually seen in a case of battered baby or a battered child syndrome. Moving further, question number 5 now, sarkari question, a lot of times asked in your examination as well. So what is the minimum blood alcohol level at or above which one can get punished for drunken driving under the Indian Motor Vehicle Act? Okay, what is your answer? So what is the level? Very good, all of you. So all of you are right, definitely. So the level above which, okay, the blood alcohol concentration above which a person will be liable for punishment if he is driving, that is definitely